Hi, I'm Dr. Vibranski of Animal 911 Veterinary Hospital, and I'm here to show you what a typical cat exam looks like. So here we have Lola. She is about 2 years old. She's our clinic cat, so she's going to be our demonstration. So I know her very well, but usually we'll start from a distance, take a look at the cat overall to see what does she look like. Is she alert? Is she scared? How does she present herself? What's her overall body score? We want to see if she's a little bit chunky and how she responds to her environment. And we always start at the head. It seems like the most important part. Also, we want the pet to get a little bit accustomed to it, so starting at the head seems like a good idea. So I'll look at the eyes. I'll look at the color of the eyes. I'll look at the size. The pupils are both equal. I want to make sure that the eyes, the conjunctiva, the tissue around the eye is not red. In some dogs, especially large breed dogs with hanging, with big jowls, we want to make sure that the eyelids are not hanging away. Because if they're hanging away, that causes lots of problems. We'll look at the mouth. We'll look at the dentition, the occlusion. That means whether the teeth are in the right place. They're scissoring on each other like they're supposed to. We want to make sure that there's no retained teeth. We want to make sure that there's not a lot of tartar. She had a dentistry done recently, so hers are good, and she's on a dental cleaning diet, so it's fine. Next, we'll look at the lymph nodes, the mandibular lymph nodes that are right under here, and they should be just palpable. The prescapular ones, and the ones in the back, and they're not enlarged. And if they were enlarged, then that would mean that there's something going on in the tissue below that lymph node that's draining that body part. So an infection or something like that. Since I'm at the back, I'll just look at her here. So I'm looking for scales, I'm looking for signs of any kind of irritation. I'm looking at the quality of the coat. Is it shiny and lustrous? Is it dull or dry? I'm also looking for fleas and any kind of other parasites. Sometimes we'll find ticks. And we'll always take a flea comb because fleas are very, very small, difficult to find, especially on a dark colored cat. And we always comb the last 1/3 of the body because that's where the fleas like to hang around. And often we won't be able to find the adult flea, but we'll be able to find their feces, their poop, and it'll show up like little black spots. And if we put them on a piece of paper and spray them with a little bit of water, they'll turn red. And Lola is a good kitty cat, and she doesn't go outside, and she's on Revolution, which is a preventative for fleas and intestinal parasites, so of course she doesn't have any. So, since we're at the back, I'm going to check her pulses on both legs. I want to make sure they're equal on both sides. They are. And since I'm at her leg, I'm going to check her knees, see if her patellas are okay. I'm going to check range of motion in all the joints, in the hip as well, on both sides. Yeah, this should be all non-painful. For a young cat, it usually is not, but if they get older, a lot of cats, actually the majority of cats, when they get older, they develop arthritis, and this is probably one of the ways to see if there's anything going on. So I'm just going to check her knee. And she prefers to lie down. Okay, so I'm also going to go through the body to see if there's no lumps or bumps. And it's also a very good way to evaluate her body weight. Hers is a little bit, right? Mm-hmm. A little bit on the plump side. She's a little bit too heavy. We need to cut down on her food intake. Okay, then we're going to move back to the head. We want to check her ears. This is odd. I want to see presence of inflammation, wax, debris, anything like that. She has a little bit of wax, but no inflammation. That's good. Both ears the same. We'll usually, if there's a little bit of wax, we'll show the client how to clean the ears. So the ears are okay. We'll check the eyes. So same again, I'm looking, the pupils are same size. I'll see the reaction to light on both pupils. Usually we'll do this with the light closed, but for the sake of the movie, I'm not. Then I'll take the ophthalmoscope and I'm going to check the fundus of the eye, or the retina. I'm looking at the blood vessels. I want to see that there's no signs of bleeding in the retina. I want to see that the blood vessels are well colored. Sometimes if they have anemia, if they have anemia, those vessels are going to be very, very pale. And then we can also see signs of hypertension in the retina because it causes bleeding. And then I'll focus out, looking at the cornea and the lens to make sure it's transparent. There's no sign of opacity. And of course, she's a young cat and hers are fine, so there's nothing there. Next, we're going to move down toward the belly. So on a female cat, I'll always check the mammary glands, even if it's neutered. So they have five pairs of mammary glands, so 10 in all, usually. So we want to check all the way up to the top. And then we'll go into the abdomen. I usually start at the back. Seems to be easier. So I'll start at her bladder just to localize it, because it localizes where everything is for me. Her bladder is quite big. It's the size of a tangerine. She needs to go pee. Then I'll move up to the colon. She has some formed stool, so she doesn't have diarrhea. She has no pain. I can feel her intestines. I'm looking, in an older cat, I'm looking for signs of discomfort or a mass. Okay? In a cat, I can usually feel the left kidney very, very easily. And I'm looking for the size. I want to see it's smooth, it's not knobby, that there's no pain, and it has to be of a normal size. On a cat like her, it's the size of a plum, roughly. Sometimes it's a little bigger, sometimes it's a little smaller. The right kidney is a little bit hard to find because it's further forward, but we can feel it too, and it's fine. We can't feel the stomach or the liver because it's too far forward, but we can very definitely get a very good idea if there's any problem in the abdomen. I'll listen to her chest first, both sides, and then her heart. We listen to the heart in 3 different points because we want to see the different valves. And we're looking to hear the rhythm, the rate, and we're listening to heart murmurs. She's fine. Okay, so overall, once the exam is finished, I'll give an overall reassessment. So I think that Stephanie, that Lola is healthy. There's nothing that concerns me other than her weight. I think we need to cut down a little bit on the quantity of food. We'll do a little calculation here. We'll do some measurements on her body, and we'll figure out what her daily ration should be, and we'll set it up. So thank you very much. So this is what an exam of a cat looks like at Animal 911.